Did you know that every single routinely offered test, procedure, screening during pregnancy and birth is optional? Often people think that they are mandatory, that you have to have them done, but that's not the case. I always talk to my clients about a screening of any sort, and how before you decide whether you want to have things done, think about what it would mean to you. Think about what you're going to do with that information. So an example of this would be perhaps having a scan. Do you know that it's not just to get a picture? That it's so the first scan is a dating scan. So they'll measure the baby and predict a date that you might be due based on that. So that's something to consider in itself. But then also they will offer screening for trisomy syndromes. What does that mean to you? What would you do with that information? And then another one to think about would be, say, screening for Group B Strep. So if your screening came back positive, what would you do with that information? Does it change your birth plan? Would you, say, if you were planning a home birth, would you still want to go into hospital? Would you have antibiotics in labour, or would you not? And considering things like that, Group B Strep is transient, so it means that you can have a test and it can come up as positive, and then you're negative during labour, or vice versa. You can come up and you can have a test and it can come up as negative, but you could be positive in labour. So that's another one to consider. Or gestational diabetes, that's another screening. There's so many different things that are offered in pregnancy, and often they're not offered as a choice. You're just told, oh, we're just gonna take some bloods, these are what we're doing, or I'm just going to do an examination on you, in labour to check your cervix and how dilated it is. What does that mean to you? Actually, the history of vaginal examinations, when they first came, there wasn't any strong research to support them when they were first implemented, and they were specifically they were advised to only be done when they add to the clinical picture. But we seem to have created a culture where we're so used to doing them that they just seem to happen more often than not routinely. So yeah, that's another thing to consider. And I guess I just wanted to do a post to highlight how everything is an offer, and you're in control of your body and your choices, and what tests and screening and procedures that you accept or decline. And that goes from everything right from your booking appointment, when they're going to be offering bloods and recommending things like whooping cough or flu vaccine, or your scans, right to when you're having your baby, things like the CTG monitoring, or things like having the monitoring that goes on the baby's head, or having examinations in labour. Everything has implications, everything has benefits, risks, and it's a choice, and it's your choice, and it's your body. So I would ask questions. Don't just accept that you have to do anything that someone says to you. Question things. Get comfortable questioning. Start it right from the very beginning. Start it from when you find out you're pregnant. Start it from your booking appointment. Get used to asking questions. It's okay to ask questions. It's okay to question routine practice, to make it personal to you. Because you can't have personalised care, you can't have care that's about you unless you bring yourself into it. So yeah, that's all for me today. I just wanted to share that because I saw a post from a friend, Antonia, who was sharing about her declining she didn't want scans, and how people react to that. It's really interesting because we're in a culture where we're so used to doing certain things, we just carry on doing those things without actually questioning it. And then when someone does question it, it kind of brings things up in other people who perhaps not realised that these sorts of things are a choice. So yeah, your baby, your body, your choice.